Vic and Eller. Thanks for watching the Hellstorm today. This show was really fun to record. I've known Eller Mallchok for several years. She's the managing director of Jumpstart Foundry, one of the 4 funds that we work with. And it was a lot of fun to talk through her perspective on the Hellstorm. We talked through a lot of things. I hope you watch it. It's a great show. Thanks a lot. Eller Mallchok from Jumpstart Foundry. Okay, Eller, welcome to the Hellstorm. Thanks for doing this.
Thank you for having me.
We work together all the time, but you haven't actually come over here to do a full
I
Hellstorm.
know. I get to sit across from you at this nice table.
Yes, at this perfectly socially distanced, exactly 6 feet distance.
It's perfect.
So as we get started, obviously we've worked together for a long time, but give the audience a little bit about your background.
Sure. So I am a Tennessee native, originally from Chattanooga, but obviously made my way back to Tennessee. Mm-hmm. I went to undergrad up in Pennsylvania at a small liberal arts college, Dickinson College, where I majored in biology. So I was a scientist. And I think, like a lot of us at Jumpstart.
Yeah, same background I have, yeah.
A lot of us at Jumpstart have this similar background where we, studied a science, were really into research, like the whole scientific process, but didn't necessarily feel the calling of a traditional medical degree, and found myself kind of after graduation not gravitating towards that. Instead, I kind of got involved in a few entrepreneurial groups, both at Dickinson, but also in my hometown. So I ended up interning and working for a women's angel network called the Jump Fund. So obviously not related, as you know. But that was kind of my first foray into early stage venture. Loved it, really wanted to, engage in that world, but wanted to use my science and health background. So did just that, kind of found you, kind of right time, right place, and have been able to both kind of leverage my interest in health and wellness, but also, this scientific process that we implement at Jumpstart Foundry with let's test, let's figure out what's not working and build it better and test again and always be doing that. And so that's the quick background.
So at Jumpstart broadly, you're the managing director of Jumpstart Foundry. Mm-hmm. And so what does the managing director of Foundry mean?
So that means, I am overseeing our full portfolio. Right now it's 93 companies, very soon to be over 100. Yeah. So overseeing the management of those founders, making sure that they're making progress, building value, and then on top of that, making sure they're getting the connections that they need, whether that's to mentors, customers, follow-on capital resources. So it's a lot of work to manage and oversee a lot of that.
And so just for the audience, you manage one of the 4 funds that Jumpstart has broadly, and it's the biggest by far. And the first. So you're on Fund 7, just putting together Fund 7 right now?
Just putting together Fund 7. So it's a unique model where it's an annual fund. So it is, we're the biggest, but we raise an annual fund, so $3 million every year, and that builds up over time. And so it's become a lot of really just a lot of work to bring in companies, use that as a fuel to the other funds, so Capital, Direct Impact, Eclipse, use Foundry as the fuel to this bigger engine that we've created at Jumpstart.
So talk to me about your background in science. You sort of touched on it. How does that point of view or that way of approaching the world filter into your day-to-day investing? Yeah,
definitely when I first started with Jumpstart and kind of moving into this managing director role, there's a lot of...
When you first started, we were all trying to figure it out.
Yeah, exactly. But, for any fund manager, I think I had this, somewhat of an imposter syndrome of like, I don't have the art. I don't have that artistic touch. I don't know it.
You haven't been an investment banker 30 years doing deals on Wall Street.
Right.
That a lot of fund managers have. I think that might be a handicap.
Well, right. And so that's how I thought of it as, it's instead of like this secret sauce that you have to know or learn from years of hard work and experience. Yes, that's hard work and experience is helpful. But instead of like this innate knowing it, let's actually use the scientific approach, come up with a hypothesis, test it, look at the results, and then switch up how you're doing it to get better results. That really is how I approached it and how I've continued to, year after year, improve Jumpstart's model, our thesis, how we work with companies. And it definitely makes me, I think, a more open and more open-minded fund manager to say, this is not an art. We can boil this down to a science and we can improve it year to year. So
excellent. Well, thanks for doing the Health Storm. As you know, I've been exploring this idea that there's a huge disruption coming to the U.S. healthcare market in the next 2, 3, 4, 5 years. I've been doing this now. You're my 26th guest. So I've been doing it for 9 months.
I can't believe you've waited this long to bring me on.
I know. Well, I wanted to make sure I knew what I was doing before I brought in the big guns. Right? I thought you'd embarrass me if I came too early. So I guess I started this at the beginning of 2020, and then, of course, COVID hit and changed everything. But I think the thesis is the same, which is there's a storm kind of on the horizon. I think it's kind of here now, that is really changing the entire U.S. healthcare system. And that's going to really impact everything that we think of as U.S. healthcare. There's 4 big drivers of the storm itself. I think it's been accelerated by COVID. But the 4 drivers are that technology is being used to make the healthcare system more efficient, earlier diagnostics, less cost. Let's engage with people where they want to be. Let's do telemedicine. Use technology like every other industry uses. I think there is this theme of the rise of the consumer, and consumers trying to take control of their own healthcare, be involved in the decision-making process, and make a difference for their own health, not just listening to the man in the white coat sort of exactly tell them what to do.
Yep.
There's this kind of unpacking of the hospital, unbundling of the hospital, where it used to be that everything was done in a big brick building called a hospital, and care is now moving out of that building to the community, to the neighborhood, and to the home. And I see that as sort of driving massive change. And then the 4th is market entry. Big non-traditional health companies are moving into health and bringing their understanding of these other trends. So Google, Apple, Amazon, Walmart, and lots of others are sort of entering the space. That's what we've been talking about on these videos. Give me your impression of those trends. Do you agree with that? Are there holes in it? Where do you think it's right and wrong?
I mean, I think overall I agree. That said, I think there are some elements that we can weave in here that just overall sentiment in the world right now that is kind of shifting everyone's perspective on their own health, on their trust in the healthcare system. I mean, particularly around COVID, no one knows who to turn to. No one knows what the credible source is. And, traditionally that's been your doctor, the man in the white coat. You turn to them. But so much of what's happened over the last 6 months, people are relying on each other. They're relying on large new, news and media outlets. They're relying on tech companies to tell them what to do. They're relying on their favorite brands. And so that whole theme around the consumerization of health, I absolutely agree with that. But I think there's even more to unpack of, what is the public sentiment and where are people pulling their opinions, their ideas of who to trust, who do I turn to. And it's I think we're seeing it's continually pulling away from what it traditionally has been of like in the hospital from the doctor.
Yeah, and I think health is such a core foundational part of all of our lives. Like we all are sons and daughters. We all are going to have health issues.
Yep.
We're all going to see a loved one get sick. Eventually, we'll get sick and pass away ourselves. No one lives forever. So health is sort of central to us living a rewarding life. And it used to be that we ceded that, one of the most foundational things, to other entities, the doctor or the hospital. And I think to what you're saying, people are no longer ceding that anymore. It's too core to
right.
what what we need help with,
Right.
to trust just one entity. So we end up with this kind of mishmash of, I do have a doctor that I go to, but I also engage online, and I'm in
Right.
social networks, and I'm talking to my friends and my family.
Yep.
I see that as sort of growing over time. And what I want your feedback on is, how do people navigate that? There's so much information coming at us.
Yeah.
How do you know what is real, what is opinion, what should be counted, what should be researched more?
Yeah, I mean, people are ultimately going to be making decisions of what news outlets they listen to. You know, they're going to be making the personal decision and themselves. And so I think what can drive and influence a lot of that, of, you know, a company saying you should pay attention to my opinion or my truth telling, is the, you know, trust with the brand, the building the brand. So I think, you know, health systems, the traditional kind of providers, payer organizations, employers, if you have a strong brand that builds trust with your consumers, your patients, that population that you're serving, that's going to build trust, and then they're going to listen to you, and they're going to pull in, you know, they're going to pull information, pull whatever influence you have over them to make their own health decisions. I think you're seeing that with people making healthier, you know, wellness decisions based on brands or influencers that they're following.
Yeah, and we've seen that in other markets.
Right.
It's very, very common for automotive or finance or tech. Like I've driven Nissan cars for 20 years.
Right.
And that may be because I'm boring, but it is partly because I really trust that that Nissan cars and SUVs will be high quality, and when I have a problem, the company, the brand, takes care of me. I don't necessarily know who the mechanic is or who the person is.
Right.
I just trust that that brand will be strong. I think Apple is probably the most trusted brand in the world.
Yep.
And it's interesting that Apple is moving into health.
Yep.
They're one of the new market entries.
And I think, but what's going to be interesting for consumers and individuals to pay attention to is, you know, if you break that trust, and you can break it very easily, it's not like there's nowhere for them to go. There's going to be a million different competitors with equally, maybe not totally equal, but pretty closely strong brands that they can turn to. And so I think you're going to see,
trust over years or decades, and you lose trust in one moment.
Right. And so I think there's going to be fluidity between, you know, patients and individuals moving from one resource of getting their health and wellness to another very quickly. I think we're going to see a lot of movement. So.
Yeah, interesting. So I want your thoughts about how COVID will affect this. So it strikes me that COVID has been, you know, the front lines of our treatment for COVID have been in the hospitals. If when you get sick, you go to the hospital, and they at first were struggling, they now really understand how to treat the disease. The treatment success has gone way up, fatality has gone way down, and that's largely due to the effort and hard work of our doctors and hospital systems. And at the same time, COVID itself has removed a lot of the elective surgery, removed a lot of the higher profit margin types of procedures. And so it's brought, you know, an awareness that hospitals are really an important place from a public health point of view.
Yep.
And simultaneously, it's brought incredible financial pressure on those same places. So how do you think that turns around? Do you think that hospitals will evolve? Do you think, so the payer community, the insurance companies, have benefited? They're making more money, returning money to their policyholders.
Yep.
And I think that positions them well to make strategic actions to sort of get a market advantage as the health storm is coming. How do you think we should understand that dual dynamic of it? It's super important, and yet also they're struggling.
You know, I think hospitals are going to continue to struggle if they keep with the status quo. I think that there's no question there. So if the second you look at a hospital or health system that's ignoring this, I mean, they're dead in the water already. Yeah. But I think they have to prepare themselves for how do they meet their patients outside of what they have done traditionally. How do they meet them in the community, in their home, in their workplace? You know, how can they take so much of what is traditionally done or in the hospital and get that away from the hospital. Again, consumer-centric.
Spoken like a true VC. They need to be open to innovation and change and utilize the tools that you're bringing to market and others are bringing to market.
And I think we're seeing examples of, health systems that are doing that and those that aren't. And it's those that are kind of are on this leading edge. And again, pulling people in, that brand trust, that wow, they're doing things in innovative new ways that are convenient for me. I'm going to build trust with them.
Yeah, interesting. I want your perspective on this thesis that I have that timing is everything. So like in investment that we focus on, but also just in innovation broadly, healthcare is highly regulated. Change comes slowly, and probably that's okay because human life is at stake. My theory is that this storm of change, kind of like a hurricane moving across the industry, there are outline areas, the edges are going to change first. And then as that starts working, other segments will then be affected. Talk to me about your view of timing in general. How do you think about timing? And then does that analogy hold up? Does that make sense?
I think it does make sense. And I think like a hurricane, though, and maybe this is like just recent news of the hurricane coming through right now. Yeah. They're saying it's like one of the most slowest moving hurricanes ever, and it's going to be the worst. Like the rainfall is just going to cause complete devastation and rainfall like we've never seen before. And I think this is a storm that, has been slowly building. And so, yes, we're going to have the edges start hitting, but once we get into the storm, it's going to be massive disruption. And so I think the timing piece is like you need to be preparing now because when the storm does come, it's going to be heavy hitting and you need to be well prepared in advance.
Yeah. And so what segments of health do you see as on the edge and vulnerable versus what are kind of way protected?
I think a lot of primary care is right on the edge. That's stuff
it's already probably being disrupted.
It's already being disrupted. I think you're seeing a lot of people just, moving out away from the, traditional ways they've accessed primary care. That's kind of first to go. Second, I think is, as you were talking about kind of some of these elective surgeries, they're very, they drive a lot of revenue for health systems and people are going to be seeing that. And how can you take that piece of the health system, pull it away? I mean, just surgery centers doing that. But I think people are going to be trusting in that and say, I can do that one-off. I can do that.
And that's the issue about market entry and use of technology. You could use technology to kind of steal away one really profitable segment of healthcare and leave things that are not that profitable to the existing kind of establishment.
Yeah, exactly. And so that's going to be a threat to kind of the establishment, as you just said. Like if there are aspects of the system that can be pulled away very easily, that are profitable, that can run on their own, that's going to happen.
And primary care is not super profitable. But what's interesting about it is it's a referral source to almost every other part of the system. Like if I have something wrong, I go to my primary care doc, and then he would help me know where to go next.
Right, and I think, but the thing with primary care is that so much of that can actually be scaled using technology that isn't implemented right now. I can't tell you how many, of my peers in my age group don't even have a primary care provider. Like they're not.
Yeah. If they have any needs, they go to urgent care or they do teledoc or they do something else.
And so there's this wave coming of, it's easy to have a primary care doctor and there's benefits to having a primary care doctor. And as a, later millennial and older millennial, I would say that, more people are going to engage in that because I can engage on my phone.
Right. And it turns out to be more efficient and less pricey to operate.
Right.
So
and less pricey to meet too.
Right.
Yeah, exactly.
I mean, maybe you're a later millennial. I like the idea that you can understand the millennials' point of view, but you also are close enough that you understand my point of view, or older folks, or at least you can try to translate.
Right.
So Silicon Valley made it's really fun to be recording right next to a fire station.
Do you get this every time?
Yeah, every time I'm recording, there's someone sets a fire, Des sets a fire, and then we have to ad lib as we go.
So
but I find it more interesting to sort of just ad lib.
I like that.
So as I was saying, Silicon Valley has sort of, I think Facebook, Zuckerberg coined it, but move fast and break things, and we will innovate and figure it out later. It's kind of now the Silicon Valley kind of mantra. And there's a lot of value to that. I think that in healthcare, that can be a little bit dangerous.
Yeah.
And so I want your perspective on that saying and that kind of attitude to bring disruption and bring change with two components. The value networks, meaning like the way that you would lift out a surgery center or lift out one particular thing, they're more entwined than other markets, maybe.
Yep.
And so that makes it somewhat difficult. And then secondly, it's someone's mom or dad or relative that's having the procedure.
Right.
And so, well, in general, maybe it helps to innovate, to move fast and break things. If it's your mom, I'm not sure I want to be experimenting there. So public health and patient safety needs to be kind of respected.
Yep.
How do you balance that you're an early stage investor, you're investing in unproven things. Mm-hmm. How do you approach that balance?
Yeah, I mean, the whole, just as you said, the whole move fast, break things doesn't really work. It doesn't work well in healthcare, and you're going to get a lot of people upset very easily if you just come in and start pushing stuff around. Yeah. However, that change is coming, and so I think as an early stage investor, you almost have to be delicate with how you invest, and then how you help those companies position their innovation. I can't tell you how many founders we've worked with that, they come in and they think their go-to-market message needs to be this whole like breaking through. You're not doing it right, Dr. X, Y, and Z. You're killing patients. You're not doing things right, and you need to now do it this way because it's better. One, you're going to insult doctors by saying they're killing patients. Yeah. Two, the health system just at large is one of the most, the hardest to change, hardest to, get to make the mindset shift to change. And so you have to be somewhat delicate in how you present new innovation, new ways of doing things. And I think if you can present to the health industry, here's an opportunity to make things more efficient, which ultimately will drive more revenue. Here's how you're gonna, add more patients, more revenue to your practice. Okay, now I'm listening. I wanna know how to do that. And so instead of saying like we're going to do things better and save more patients' lives than you do because you're old and doing things in an old way, it's let me actually help.
Even if that's true, it doesn't help.
It doesn't help the sales process. Yeah. It doesn't help close the deal. But if they can approach it from a position of, let me help bring in a technology that's going to improve the way that you do things in terms of, you're going to see more patients and therefore drive more revenue, get them on the hook. Same thing at the health system level.
And I kind of think that, healthcare at some level is in the Stone Age now, like no technology, no efficiency. It's all done based on personal judgment. There's no sort of standards, or not many standards. And the analogy so I started investing in healthcare in 2001, and I came out of technology, and the industry was about 20 years behind then, meaning like what was really cool in 2001, they were using like 1981 technology. And I think if anything, it's fallen further behind. So it's 25 years or 30 years behind now because healthcare has not really changed and technology has accelerated. Mm-hmm. But I think the analogy that I started working with is you can't just like give a Stone Age Neanderthal an F-14 fighter jet. Like they don't know what to do with it. They would probably kill their friends and they don't understand it. Yeah. And so we need to bring tools that can be used by the healthcare system. Mm-hmm. So, let's bring a tricycle. Then let's add and make it slightly better. Then let's do a two-wheeler and not just go right to a fighter jet because it doesn't work.
Yep. And I think that, that is the exact way to approach, the existing systems and incumbents. That said, and I might embarrass myself by making this reference, but it's like in Back to the Future 2, when the hoverboard is introduced, and it's like all of a sudden Marty and he brings the hoverboard back, into the past where no one has a hoverboard. That's all of a sudden what you're giving. Like, these large tech companies are coming in with hoverboards,
and they're going to, people don't know what to do with them.
And yes, you're giving a tricycle to a Stone Age hospital, but their competitors using a hoverboard. So very quickly, I think we're going to get to this point, going to, move fast, break things, and in some ways timing. We need to get health systems and kind of Stone Age operating systems very quickly up to speed so that they can then start competing with tech giants when the tech giants really start coming in and actually making
That's
moves.
what's really interesting about your fund, is that you provide tools to people entering the market who are tech titans and want to use a hoverboard, and they're funneling away one segment of the healthcare system. Which, by the way, is $3.5 trillion. So there's plenty of opportunity to grab market share there. And you also feed tools, you feed tricycles out there too.
Right.
And so talk about that dynamic. You have very different customers you're working with.
Yeah. So it's almost like making sure. So when I think about making investments year to year, I'm thinking about, okay, who is ready to adopt this innovation? So say it's
which big system is
which big system is this an innovation that a health system, a hospital is likely to adopt? Okay, then I have to think about how is that innovation or that new technology, how seamlessly can it integrate into existing processes? Say if it's another company that is maybe more targeted towards a tech company, they can be a little bit more innovative, a little riskier, a little...
But you have to teach them where the regulation is, maybe, or you have to teach them other things.
Right, and the funny thing about the hoverboard analogy is, like, we don't even have a hoverboard today. Like, that is where the tech giants are going, though. Like, they're going to start using technology that you and I don't even know about, and that the founders that we're talking to are starting to work on. And I think that's our opportunity, is let's work with founders that are developing that next biggest new technology, while also working with founders that are developing incremental technology that can help health systems that need it today, tomorrow.
And one of the advantages of your model is you're investing in 20 to 30 companies a year. You don't have to pick one or the other. You can do 10 incredible changes and 10 incrementals, and then 10 that you're not clear what they're going to be yet.
Right.
And then sort of play it out, and there'll be different customers and different acquisition opportunities based on where you start.
Exactly. And I think that's a great position for an investor to be, so an LP in my fund to be in, is they have access to great innovation that's going to make an impact easily in a health system, and some, really cool innovation that can actually play a role with a large tech company, but driving kind of like new cutting edge technology. And
so part of the deal of coming on the Health Storm is I have to link everything back to my analogy. And so like the Health Storm analogy, I think, is interesting because it's going to be pretty painful to the incumbents, to the existing industry, and knock things over and cause concerns. But that will open up kind of white space for the really kind of quantum change for the hoverboards of the future to come in. So where now maybe the lobbyist groups and the professional organizations and the laws are not ready in some segments of healthcare, even if it worked, it wouldn't be legal. You couldn't get it pushed through. But once the storm comes by and it really changes everything, and on the storm areas where the incremental stuff works, but then behind it, when you've like knocked over a bunch of stuff, then there's a lots of white space to bring in new technologies and sort of bring it to the patients.
I mean, you're talking about the eye of the storm?
Yeah, when the eye passes, then all these like really incredible changes, I think, are open to be looked at.
Yeah, I think that's the most exciting. I think we're in a point of inflection that COVID, we were heading towards this for a long time. I mean, you've been talking about the coming health storm for years now, and COVID has been kind of like this first big gust
it's
of
really
wind.
accelerated it, I think.
Right, and so, I mean, just as we saw the kind of adoption with telehealth and people both utilizing and systems, doctors kind of adopting the technology and running a lot of their processes and engagement, patient engagements via telehealth, I think that just the pace at which that was adopted was so fast.
Yeah.
I mean, I think within a matter of weeks, people were standing that up.
And it's because the capabilities, the technical capabilities, and the willingness of the consumer population to use it was already there. Mm-hmm. None of that had to be created. Right. It was simply regulation and reimbursement. So is this allowed?
Yep.
And can the doctors get paid? Is there a structure to get them financed?
And so now that door's been opened and that the path has been made of, this is not only is it allowed, it's reimbursed, X, Y, and Z, all of those kind of, foundational building blocks are there. Now you can start introducing new technology that, is in some ways, on par with that telehealth kind of emergence. You're going to have a lot of adoption.
And we sort of cleared out all the regulation, as you're saying, in probably 2 weeks, 2.5 weeks.
Yeah.
Because it was a public safety crisis.
Right.
But now I'm not going back. Like no one's going to go back. The docs like it, the patients like it, everyone likes it.
Yep.
And what's interesting is I have a friend who's a cardiologist. He is here in Nashville, but he's treating patients across the country now. So it opens up this new competitive landscape where it used to be you had to be within an hour, even a 30-minute drive of your doctor, because you had to see him or her in person. And once you move to telehealth, you can they can compete across the country.
Yeah. But I think alongside that is, okay, now everyone's using it. And now that everyone's kind of under this new status quo of telehealth and they're engaging with it, it's better for the patient, better for the provider. We're starting to see some flaws in it, data security, things like that. That then...
Fraud. I mean, there's some fraud. Yeah.
A lot of fraud. So, but that, I see that as opening up yet another opportunity.
That's another place for you to invest or for founders to try to figure out.
Exactly. It's like, okay, telehealth may have some risks associated with it, but that doesn't mean it's going away. Instead, okay, now we need to tack on things that make telehealth more secure, more safe, and essentially kind of make it the new standard. So. Yeah.
I agree. So let's talk about Jumpstart Foundry itself, because it's pretty unique in the investing space. Just explain how your model works. How is it possible for you to do 20 to 30 investments every year? Yeah. How much capital you put in? How does it function?
So, I mean, kind of first and foremost, I like to tell people to kind of think of Jumpstart Foundry in some ways as like an index fund for health innovation. It's an easy way for an individual investor to allocate some money into the fund. Our minimum investment is $100,000, so allocate $100,000, and then you're immediately diversified into 20 to 30 assets every year. So it's like an annual index fund. It's unique in that if we're doing 20 to 30 investments every year, that's a lot of deals I need to review to get down to 20 investment offers. So I think a thing that we've kind of made central to the Jumpstart Foundry model is that, one, we need to be out in front of entrepreneurs early and as often as possible so that we can get to 400, 500 individual applications every year.
So just contrast that away from kind of traditional venture.
Yeah.
Where maybe I have a network, I have some friends that I've worked with before, and I have like deals sent to me in my email. And, I then look through the email and the attachment, maybe a deck. So you are proactively instead of being more waiting for the network to send you things. You're reaching out and trying to find them.
Exactly. I am actively recruiting founders to come look at an opportunity with Jumpstart Foundry. In fact, we actually just launched an online community to attract founders to the Jumpstart community. It's called The Refinery. We, want any healthcare entrepreneur to join The Refinery, learn from one another. That gives us kind of an open view to here's what's happening with early stage founders, and they can learn from each other. We can learn from them. We can get new founders in there and kind of help provide them with resources so that when they do finally kind of get things off the ground, are ready to take on, a bit of capital to start their business, they've been associated with us.
You've already been helping them.
We've been helping them a little bit. They know us. They know how we work.
It's a way for you to help hundreds, thousands of companies a year, as opposed to the 20 or 30 that you're to invest in.
Right. But then going back to kind of how Jumpstart's process is very differentiated from kind of traditional VC. A traditional venture capitalist is going to be looking at, maybe 100, 120 if they're really good. Investment opportunities every year. That's 100 pitch decks and kind of financial summaries and everything like that. That's a lot, and it's a lot of context switching if you think about it. Whereas I, really am trying to implement more of a standardized process. I always kind of relate it to like the Common App when applying for college.
Okay.
Yeah.
So just for the audience, like a Common App, you fill out this form, and you can submit it to 10, 20, 30 colleges.
Yep. And you only have to fill it out once, but it's standard. And so kind of think about it as, I have a Common App on every single applicant. Instead of context switching from one pitch deck to another, I'm able to compare, how one company answered a specific question to how another company answered that exact same question.
So they key in, or maybe they cut and paste, they put information into this app, and then you have information on all 400 or 500.
Yeah.
And it's same format, or all the same structure.
And so it allows me to benchmark companies against each other, which eventually, can help the companies, help the founders understand, okay, here's where I maybe need to improve aspects of my business, where, I may be ranked lower as compared to other companies that are in the refinery. Yep. Maybe I should work on that. Maybe I should bring in a mentor or a team member to help kind of,
And so of the 500, are there certain parts of the app that you're looking at, or how do you know which of the 500 to look to get to know more?
I mean, it's again kind of that application pulls in data on, team makeup that I'm looking for, right? Customer traction, size, but really kind of all of those points about kind of the stage of the business, traction, things like that. Of course, I'm going to look at that, but a major thing that I focus on is, the market opportunity and the does the product that they are building, does that product serve or, meet a very specific known pain point in the market? I think that is how one applicant can really differentiate themselves from another, is they not only can explain and clearly articulate what the pain point is that they're solving, but Jumpstart has recognized that is a real and validated pain point in the healthcare industry. God bless the entrepreneurs that are building new and creative technologies and innovations, but if that innovation isn't
if the market's not ready for it, it's not solving a problem, it doesn't matter.
They're going to build a cool technology that no one's going to buy and no one needs. And so that is a big thing that I look for when applicants are filling out their Jumpstart Foundry.
And we were talking before, so I know about it. You have some kind of score that I think in a way compares all these companies to each other.
Yep.
How does that get compiled?
So, it's kind of on the back end. That score gets compiled on, the Jumpstart Foundry sees. We, take that score based on how you answered questions about your previous experience or the team makeup,
So several parts of the app get somehow combined.
Yeah,
into it.
it's all in kind of a proprietary algorithm of saying, okay, if depending on how they answer these questions, they're given a weighted score.
Okay.
I then take that and say, okay, from these 400 applications, I know which are the top companies. Let me focus on these top 50. And then, much like traditional VCs, I'll take I kind of call it like our white glove due diligence approach of, let me look more deeply into these top 50 companies.
So you do talk with the entrepreneurs,
Absolutely.
At when it gets to 50 or 40 or something, then you.
There's no way we're going to talk to 400. That's just impossible. I should maybe never say impossible, but but it's at this point, there's no way we can talk to 400 entrepreneurs. But I can, once I know kind of the top tier of companies and founders that I should be talking to, then I can engage in a much more intentional conversation of, okay, tell me more about this opportunity. Tell me more about your experience, the product you're building, the vision that you have for the business. And so that, to me, that then brings in a more traditional venture approach of choosing the best companies to invest in. So it's this really interesting blend of, again, going kind of back to the beginning here, but a scientific approach of finding and identifying top companies and then only spending a lot of time with those companies and not spending a whole lot of time on a company that just isn't going to be a good fit from the beginning.
Yeah.
Yeah.
Okay, so you pick these 25 companies out of the 400 or so, and you invest in them.
Yep.
And then how do you engage with them after that?
Yeah, so typically what we do is there is an initial period where we're just getting to know the companies, getting to know the founder, making sure that they know how we operate. So there's an initial, call it onboarding, where we all get on the same page, kind of set some strategic milestones that we think they need to hit over the next 6, 12, 24 months.
So there's like an alignment of, let's go try to do these things.
Right. So making sure that we know, that we and the founder are aligned in the end goal. Mm-hmm. Because that's another thing is, if we're all completely misaligned from what the end goal is, then we're going to be working towards
if you don't have agreement
different
on where you're going,
right.
You're never going to get there.
Right. And so that's kind of step one. Step two is making sure they get the resources that they need to grow. Mm-hmm. Typically, that's other mentors that can provide guidance or influence, connections, introductions to customers, pilot partners, potential early customers to buy their product.
That's interesting. So you might know this hospital or this insurance company would be interested in what you're doing.
Absolutely. I mean, that's the whole point of the, know the pain points before you invest in the innovation behind it. So, in order for us to know what those pain points are, we obviously have to be talking to the industry. So if I hear a pain point from an industry partner, and then I invest in a company that has a solution to that pain point, I am naturally going to introduce that founder to that industry partner.
Yeah, and it's sort of a warm lead for the company.
Right.
And your industry contact is happy. You're looking out for them.
Right. But, that said, I want to make sure that when I make that introduction, that warm introduction to an industry partner, that the company is ready for it. Mm. And so in the refinery, and this is kind of an exclusive aspect of the refinery for Jumpstart portfolio companies, is, steps or kind of a guide, if you will, of how to reach that ready point.
Okay. Like, when are you ready to go to this customer?
When are you ready, and when are we confident enough that you're going to nail this conversation?
Yeah, I mean, the management team probably always thinks they're ready.
They always think they're ready. A lot, I'd say about 90% of the time they're not. Yeah. And so they need a little bit of coaching. And so making sure that we can help them refine that pitch deck, whether it's a sales pitch deck, an investment pitch deck, working with them, giving them resources and tools to prepare for that, so that when we do make the introduction or they do make the connection to someone, it goes very well. Yeah. I think that's a big part of making sure that the portfolio companies perform.
It's interesting because it almost saves them time too.
Right.
Even though they may not love you holding them back, it's a waste of time if they're not ready.
Right. And then I think the other thing is, because we're investing in 20, 25 companies a year, we're obviously going to have a new class of companies coming in 12 months later that we're going to go through that onboarding process with. But that's not to say that the companies in the existing portfolio just are off the radar. Absolutely not. We keep in touch with them, and I would say we more move to a very strategic partnership where we're coming in and helping them, at really important moments when they're closing a major customer. Maybe they need additional introductions to pilot partners or customers. When they are raising a Series A round. That's when we kind of can really loop in, help them in a pretty important milestone event, and be there beside the founder to help them navigate it.
Yeah, so the first 3, 6, 12 months is kind of this onboarding, getting to know them, getting them
kind of setting
started.
them off on the right path.
But then for key inflection points or key kind of transitions, you're helping for the rest of the time.
Yeah, exactly. And so it's, it's a lifelong partnership. We invest, and it's not like we go away. We don't disappear from your cap table after 12 months. We're going to be there, and companies should see us as a strategic partner as they navigate all of those kind of milestone events down the road.
Interesting. So how has the performance been? I mean, I know you invest really early, but like your 2016, 2017 funds are beginning to be, 3, 4 years old. How are they doing?
They're doing really well, incredibly well. I have to, give my little plug here. Our 2016 fund is just completely knocking it out of the park. We invested in 18 assets in 2016. We've sold 3 major assets. It's returned, just over twice the invested capital.
Yeah. Wow. So just in 3 or 4 years.
3 or 4 years, we've doubled our.
And is that fund finished now?
No, there's still. So that's the beautiful thing is 2016 is kind of following this hypothesis that we created back when we started investing is, okay, let's invest in 18 assets. We're likely going to see some activity after kind of 3, 4, 5 years. We have started to see that. We've returned all of our investors' capital plus some, and there's still 9 active assets in that fund.
Yeah.
And so we're now, to this point of, okay, with these 9 active assets, how can we work with the founders to really position themselves in a strategic way to build value both for the management team, but also for Jumpstart Foundry and our LPs.
Yeah.
What is going to be what's the goal here over the next 1, 2, 3 years?
Yeah. Okay. And can I invest in 2016? I want to go back and.
Unfortunately, no. Our 2016 investors are lucky. They're lucky limited partners. They're part of a very.
But to be
successful.
fair, there was less evidence then, and so.
Right, and so now you're more than welcome to join the 2021 fund.
Okay. Yeah.
That said, because we're investing year after year and it's becoming very attractive to all of our existing investors, we do want to honor those investors that decided to come in 2016, have done very well, and have invested year after year. We like to say, all right, every existing investor, we're going to be raising 2021. We've saved your seat. You have first dibs on it.
Yeah.
But then, then we always do like to open it up to new investors. So we always reserve a portion of the new, this upcoming fund for new investors to get in. But that portion may, grow or shrink depending on how much of the existing investor base comes in.
If they come in or don't come in. Yeah.
Right.
Yeah.
Right.
Okay, so the last thing I want to talk through is the concept of an index fund. You've mentioned here, you've written about it as well. Help me understand what that means. An index fund typically means every company in the S&P 500 or in a particular space. And it strikes me that in early stage healthcare, I don't know if I want to be in every company in healthcare.
Yeah.
And so is it the top portion or particular types of companies? Or how do you build the index? And how can you ensure it's going to be good financially for the investors?
Yeah, so we are taking and are focused on investing in the top 10% healthcare innovations every
Okay.
year. So across the country, it's our goal to find as many, find all early stage healthcare companies. And we're going to get them to apply and then
Yeah, so you
find
try
the
to
top
get everyone to
10%.
apply, and then the top 10%
Yep.
is what you're investing in.
That's what we're investing in. And on top of that, though, we like to build a portfolio that is diverse across healthcare. So yes, we're focused in on healthcare, but there are many facets of the healthcare industry that, that are lucrative to be in. And I don't want to have only, healthcare IT companies when in fact there are some consumer products or services or consumer technologies that are going to do very well over the next couple of years. I want to have a healthy mix of healthcare IT.
Yeah, so you're kind of diversified in different subsectors.
So making sure that our investors have a broad diversification from year to year across all of health innovation. So whether that's technology, consumer products and services, maybe a device, maybe a security platform, a lot of having a nice spread across the industry allows for our investors from year to year to, one, decrease risk. Just you never know what part of the industry is going to really get hot. But two, it's allowing us to get into a lot of interesting new things. So going back to, let's get into investing into some tricycles that can help immediately. But let's also maybe look at a hoverboard.
Yeah, interesting. Okay, great. Well, that's really helpful. The one thing I want to close with is you've been doing this for 5 or 6 years now and had a lot of success. What do you wish you knew when you started? Like when you left college and came here and I didn't know what I was doing and you helped me try to figure it out.
Yeah.
What do you know now that you wish you knew then?
It's a great question. I think for me as a fund manager, having the opportunity to watch both entrepreneurs, first-time entrepreneurs or first-time investors, kind of taking that leap of starting something is like, I wish I knew, and I wish I had. It's more so I wish I had the perspective of like, you don't have to know absolutely everything to jump in, dive in, and start investing, start the company, start building value. Everyone around you may seem like they know everything or have the confidence in doing it, but
they're faking
it. They're totally faking it. And I think, it's less a piece of knowledge I knew, but more so a perspective. Because back then I would say more people need to be doing this.
Yeah.
As long as you enter particularly the early stage healthcare investment space, and highlighted here for healthcare, as long as you enter that space with an open and inquisitive mind that your perspective is, I know this much, but there is so much more for me to learn, and if I just ask for help, then you're going to be successful. I think that was, a perspective that I came in thinking I needed to know everything, and in fact that's been my advantage, is that I don't know everything and that I'm willing to ask. And
it almost like you have a better perspective to your hypothesis might be a little different.
Yeah.
And then you gather data and learn from it. And as long as you're iterating quickly and bringing a completely open mind, then you quickly make a lot of gains.
Right, and you bring on people that are experts in specific areas, and you very quickly kind of can amass a network of people that, are combined so much smarter than any individual person could be. So I think that's the thing that I've learned the most, and this power of our network, the Jumpstart Foundry network, for our founders. And if they come in with this perspective of, I'm going to utilize that to the best of my ability, and that I don't know how to do everything on my own, the more successful they're going to be.
Yeah.
And I think that too for our investors is, can they come in, learn something about early stage investing that maybe they didn't, and then take that knowledge, grow it, and start making bigger investments, bigger bets. It's a great way to kind of level up your investing.
Yeah. Excellent. Well, thanks for doing this, Eller. I really appreciate it.
Absolutely. Thank you for having me on.